Also in Nairobi, the U.S. government is due to award to Kenya some 65 billion shillings under the Medical Commodities Project. The U.S. Embassy in Nairobi says this is the largest such award to any country by a U.S. mission.
Principal Secretary, Ministry of Health, Dr. Khadija Kasachun, representing the Cabinet Secretary, Dr. Munyu, the KEMSA CEO, distinguished guests, waheshimiwa, mabibi na mabwana, hamjambo, habari zenu, mambo. Principal Secretary, all of my embassy colleagues, certainly Karen Freeman, the USAID Mission Director, the head of CDC, Dr. DeCock, and so many others, all of the KEMSA board members. It really is a great pleasure and an honor to be here with you today to launch our groundbreaking new partnership, the USAID KEMSA Medical Commodities Program. This program is funded by the American people through the U.S. President's Emergency Plan for AIDS Relief, commonly known as PEPFAR, the President's Malaria Initiative, and USAID's global health programs. But here's what's important. Our new partnership will help millions of Kenyans get life-saving drugs more quickly and efficiently. As a consequence, the program will help save lives. We should all be very proud of this new landmark partnership that demonstrates the benefits of hard work and dedication. The United States has collaborated with Kenya for over 50 years in the health and well-being of the Kenyan people. We've worked together to improve the lives of Kenyans. And today, we take the next step. We sign and we launch the new partnership, the Medical Commodities Program. And under this agreement, USAID will provide 65 billion Kenya shillings, that's 650 million US dollars to KEMSA to acquire and supply life-saving drugs and commodities across the country. And I want to be clear about the historic nature of this agreement. This program represents the largest single bilateral award ever made anywhere in the world by a USAID mission. Largest in the agency's history. And this historic award underscores the enduring commitment of the United States to the welfare of Kenyans. Well, the Medical Commodities Program is a landmark in our assistance. It's also a major step in Kenya's capacity to deliver health services to those who need help. Historically, the U.S. government and its partners have purchased medical supplies such as HIV test kits, antiretroviral drugs, contraceptives, and malaria medicines, and then distributed them across the country. With this program, KEMSA will procure and distribute the supplies directly. And as a result, millions of Kenyans will receive high-quality medicine and treatment faster and more efficiently. The Medical Commodities Program represents a significant shift in the way we are doing business in Kenya. But I also want to be clear about one critical point. While we have confidence in KEMSA to manage this program funded by the American people, we've also taken strong steps to ensure there is full transparency and accountability. We will have extensive oversight. Integrity and efficiency in this program is not just something we hope for. It's something we require, and I know it's something that the Kenyan people demand as well. We do so because we know that corruption is a crisis in Kenya. As I've said frequently, it's undermining the country's future. Corruption threatens Kenya's economic growth, the provision of government services, and security. It threatens the country's healthcare system. It must end. And for that to happen, all public programs must live up to the highest standard. There must be zero tolerance for corruption. Public funds must